Medical coders. Today I am here to explain about the AHIMA CCS exam. How to clear AHIMA CCS exam on your first attempt. AHIMA CCS has huge demand in the market, very good salaries, and AHIMA CCS certified coders, they get more salary, very good career compared to other specialties, because inpatient coding requires lot of skill. Without proper training, understanding and applying the medical coding guidelines, practicing hundreds of records, knowing about the compliance and the Medicare guidelines, etc., you can't clear the exam. So I'm going to explain you how to clear the exam on your first attempt. Listen to this podcast completely. My name is Santosh Kumar Gupta. I'm the CEO of Medesun Medical Coding Academy. I have experience of more than 20 years in medical coding and I cleared more than 45 certifications in medical coding. Let's discuss about the AHIMA CCS exam. Before that, I want to discuss about the medical coding market. As per the President's research, you can see on the screen, the medical coding market size is more than 55.14 billion by 2034. I am repeating again, the demand for the medical coding market is $55.14 billion by 2024. Huge demand in the market for the medical coders. So what is the market share? As per my understanding, the main market share goes to the HCC risk adjustment coding because it's compulsory for the value-based care. Second is the inpatient and surgery coding, which is must for the hospitals and ASCs. And then comes the AA medical coding and then RCM or denial management. Today we discuss about the inpatient coding, and about the AA coding you can watch my channel for the more information. Let's discuss about the inpatient coding and AHIMA CCS exam. AHIMA CCS exam, to clear the exam, there are no secrets, no shortcuts. It's just the skill which makes you to clear the exam. Exam pass, knowledge, clear, the skill depends upon your mastery of medical coding guidelines, familiarity with the coding books, and also on the time management. There is no magic, there are no shortcuts. It's completely preparation, focus, determination, proper training, understanding medical coding guidelines, and practice. Okay, then only can clear the CCS exam. Okay, exam has total 107 questions. There are 97 scored items and 10 pretest items. Time is 4 hours. It's completely computer based test through Pearson View Centers, and you have to get 300 marks to clear the exam. For example, if you fail in the first exam, first attempt, then you can take the exam again after 30 days. But I'm sure if you prepare properly, you can clear the exam first time itself. Okay, what are the AHIMA domains? AHIMA has 5 domains. Domain 1 is coding knowledge and skills. The first one, assign diagnosis and procedure codes based on the documentation in the health record. So here you have to read the medical record or read the question and assign the codes as per the documentation. Keep one thing in the mind, if it's not documented, it's not done. Don't guess. Okay. Second point, identify the principal diagnosis. This is very, very important for the inpatient coders. If you do mistake in picking the principal diagnosis, the entire reimbursement will differ. The DRG will change. Okay, so to assign the code for principal diagnosis require a lot of practice. Next, apply medical coding conventions and guidelines and regulatory guidance. So every medical coder should know how to apply medical coding conventions and guidelines. You have to follow the guidelines, ICD conventions and guidelines from the AHA or UHDDS guidelines. Attach CPT, HCPCS modifiers to outpatient procedures. So when you say outpatient procedure questions, or medical scenarios, you have to assign the CPT codes, HCPCS codes, and assign the appropriate modifier. And to assign proper modifier require a lot of practice. Next, sequencing. Sequencing is very, very important in the IP coding, especially principal diagnosis and also secondary diagnosis. Next, POA means present on admission. POA guide, from POA you may get around 4 to 5 questions in the exam. You can refer the POA guidelines in the ICT-CM book. Next, demonstrate knowledge of coding edits, especially NCCA and medical necessity and MUE. NCCA is called National Correct Coding Initiative. Must follow NCCA guidelines, edits to get the proper reimbursement. Next, you should know about the reimbursement methodologies like DRGs, APCs, and you should know how to abstract the data from the health record and identify MCs and CCs. So overall, domain 1 focus more on the medical coding part and the guidelines and documentation. So you have to read guidelines more about the HIV/AIDS, sepsis, neoplasm, diabetes complications, COPD, hypertension, CHD, CVA, STEMI, NSTEMI, pain management, abortion, delivery, etc. You focus on these topics which I mentioned here. If you are good in domain 1, 50% is done, because this is very, very essential for the IP coders. You can expect at least 20 questions from the ICT-CM and some questions from the CPT guidelines. No, it's already mentioned the domain 1. So from every topic you may get some questions. Okay? And everything is in the book. An exam is open book. Nothing to by heart. But you should know how to apply the guidelines properly and how to read the document. Okay? Next, domain 2. Documentation. So the medical coder, IP coder should know how to resolve conflicting documents in the health record, conflicting documentation. For example, discharge summary may say left leg fracture, operative report may say right leg fracture. So you have to resolve this conflicting documentation in the health record. You have to identify that especially. And admission types, letter, etc. Okay? And ensure that all codes assigned by coder or by yourself are appropriate codes within the health record. And you should be able to verify and validate the documentation within the health record. Very important point. So, to verify and validate the document in the health record, you have to go through at least 500 medical records coding. So, that's what we do in Medesun. We provide more than 500 medical records which are de-identified as per the HIPAA compliance. So, automatically what happens here, you'll go through the medical record and you know how to validate the record and assign the codes properly. Next, provider queries. See, AHIMA query is very, very important. You have to follow AHIMA ethical standards. I'm repeating again. You have to follow AHIMA ethical standards and AHIMA query system. Any IP coder should know how to query physician or provider properly. So, how to query provider and how to ask non-leading questions, how to assign the clinical indicators, how to identify clinical indicators, and then get the response from the physician or provider, okay? And you should know how to analyze the documentation to identify query opportunities. So, AHIMA query is very, very important, and I am going to provide more than 30-40 scenarios for you about provider queries, and by this practice, by these 30-40 records, you will be able to understand how to query in the exam easily, and how to answer the question easily in the exam. Regulatory compliance. Must for all medical coders. So, medical coders should know about completeness and accuracy of health records. Understand the payer-specific guidelines. And here PSI means patient safety indicators, HAC, hospital level conditions. So, you should know with the condition whether it is HAC or not. And you should know HIPAA compliance guidelines, AHIMA ethics, and also you should know how to apply guidelines from the UHDDS, Uniform Hospital Discharge Data Set. The information is there in the AHIMA website. So you can just check the AHIMA website once, you get more information. Domain 5, Information Technologies. So information technology means here how to use the EHR. What are the types of EHR, electronic health records, or you can say electronic medical records. How to use the 3M software, encoder software, or group of softwares. And what is the importance of CAC, computer assisted coding. You know very well CAC does auto coding, but it's not accurate. Again, someone has to do auditing of the medical codes, right? So basically you will get questions about the CAC. And ensure compliance with the high-tech guidelines. HIPAA guidelines and high-tech guidelines. And you're going to get medical scenarios, inpatient scenarios, outpatient, emergency department. And keep one thing in the mind, even scenarios also you get the multiple choice questions. So if you know how to assign the codes properly, ICD, CPT, PCS, practice more than 500 medical records, you can clear the exam easily. And to pass the exam, you have to get 300 marks. Okay, so already discussed what are domains here: coding knowledge and the skills, coding documentation, provider queries, regulatory compliance, information technology. And you get scenarios from the inpatient or in the emergency department. Maybe around 6 scenarios. Okay, so what we do in medicine? We give training only for the certified coders only or with 2 years experience as per the AHIMA eligibility criteria. Weekly there are 2 classes, Thursday and Friday, online Zoom classes. Based upon the requirement, we will take class on Monday and Tuesday also. And every day we provide, every week we provide the homework, more than 200 questions. And we are going to have a dedicated WhatsApp group for the trainers and for the students. And we have dedicated trainer support. We are going to provide 300 medical records, HIPAA, DIA records for the practice. And 500 question bank based upon the CM, PCS and CPT guidelines. So now we provide more than 600 medical records for the practice, and we are going to provide 3 CCS mock exams. So this way, practice, guidance, applying guidelines, and asking the doubts with the trainers and clearing your doubts. This way you can improve your skill and clear the exam. One thing keep in the mind, even if you pass the exam also you have to perform properly, right? So definitely I say practice, 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 which makes you perfect. And then go for the exam. Classroom training. We provide classroom training in Hyderabad. On the live records, we provide one PC for you. You can we give a simulation of live work experience. We'll teach you step by step on how to apply guidelines, how to assess principal diagnosis, principal procedure and DRG, HIPAA complex detail. So overall, this methodology makes you perfect in subject and you can get the proper skill. Remember, for medical coding exams, especially AHIMA CCS, there are no shortcuts. You have to do lot of hard work, lot of practice. It's very easy. Means once you practice maybe 30-40 records, you understand how to assign the codes easily. Okay. Note: Medesun does not offer any job money pass guarantee. See, Medesun, we deal with corporate companies. As per the law, we don't say any pass guarantee, right? It's an illegal word. Because when you say pass guarantee, you won't study, right? So people will not study because I'm seeing this 20 years. People always search for shortcuts, right? No, AHIMA CCS or any exam, there are no shortcuts. And please don't come to medicine if you expect any shortcuts. Come to medicine only if you have time to practice, then only come to medicine. We give rigorous homework, you should do the homework properly. Okay, there is no luck. It's your knowledge and skills helps you to clear the exam. And you have to must attend all the classes, complete the homework on time, clarify the doubts, and practice 500 medical records compulsory before going to the exam. So this is the way we empower you with the knowledge and the skill and clear the exam comfortably. So any questions you have, you can visit medecunglobalwebsite.com and you can send the inquiry and I'll help you. We are going to start a batch every month, first week of every Thursday. Minimum we have only 50-60 students per the batch. So if you're interested, please come to Medesun and you can enroll either classroom or online. Now repeating once again, there are no shortcuts for AHIMA CCS exam or any exam, any coding exam. You should do a lot of hard work, practice, do homework on time. Especially the advantage of medicine is we provide the medical records for you is a live work experience, almost equal to live work experience, where exam becomes easy for you when you go for the exam with proper practice. Training duration is going to be for 2 to 3 months because we take weekly 2 classes. You can complete the 2 months also, but I say just spend 2 months of time, understand all the concepts, and then go for the exam. This way, if you plan properly, you can clear the exam within first attempt. And also one more thing, AHIMA CDIP exam also has more demand. So you pass CCS exam, again within 1 month, I provide CDIP training also. You clear the exam comfortably, because if you pass CCS, CDIP is very easy exam, because the concepts are same, some domains may change, and CCS, CDIP, you will get a wonderful career. My objective is that every student should clear the exam with the skill, not by just knowledge. Skill is very important. Thank you very much. You can visit my channel and subscribe for the more information.